So we are using the expanded access program that Signatera has provided. And actually, we have been using the Signatera test even before COVID-19, the epidemic came about, because I believe in the clinical relevance of these findings already at this point in time. But COVID-19 actually made this program even more important, since we're trying to limit the time and the numbers of days that patients actually have to come back to clinic. And it influences a lot of discussions that we have in terms of duration of therapy, switch of IV chemotherapy in the adjuvant setting to oral chemotherapy, and potentially also, and this is important, monitoring patients on a molecular level, on a blood level, and instead of bringing them back for scans that we normally do when we bring patients back every 3 to 6 months, for the first 2 or 3 years, after resection. So we have a tool in our hands which can allow us to do blood draws at home through a home phlebotomy program, in lieu of bringing patients into our facilities and scanning them to look for recurrence. The problem is, of course, that the data are not yet as solid in terms of prospective clinical trials that we'd like to see to validate this approach. But from all the data that we've seen so far, it makes a lot of sense, and we have clear evidence that an MRD test is able to really capture these patients who have recurrences, in particular with a tumor-informed test like Signatera.